I didn't see a loss by doing it, and it got us a little bit down the road. It was a baby step. Well, we got into the session and everything looked good. We had the votes. Our House leadership said, no, you got to find the money. So that was kind of a new twist. So we started looking at sources of money besides the general fund. And lo and behold, we came across tobacco tax and millennium money. All is tobacco driven, right? So we thought tobacco is negative to healthcare. Why don't we use those dollars for healthcare? And we know that the working poor smoke at a dramatically higher rate than higher income people. So we thought there was a real nexus there. But then it was like, all of a sudden, just like a light switch, when we started nosing around those dollars, all of a sudden PCAP was awful. Awful. And the turning point in the session was when Representative Wood, Chairman Wood, took his bill in to allocate some of the millennium money to cover the primary care access program. He did, and we had the votes. Lurcher's committee had the votes on Thursday, and by Monday, Representative Moyle had totally destroyed it, and all the votes went the other way. And then, unfortunately, the Democrats decided that that was going to be their statement day of saying, well, the PCAP's not enough. So they voted. So I'm sitting there and thinking, well, this is awful. I have the Democrats and the conservatives against me. Well, this is a lonely place to be. I figured, well, if we could get the conversation going, and it did. It did. I tell you what, there was all kinds of conversation about healthcare this last session. I think I presented at least a dozen times to various legislators in the State House. And we have now some folks that, down there that know a lot more than they knew before. And coming right up to the tail end of the session, we really still thought we had the votes. And it was only on the last day that we went from 38 to 0.